during the pandemic. Closer look into Steuben County, focusing on the opioid epidemic, treatment, mental health. This just a little housekeeping items. This is our very first series of the virtual webinars, so we may have a little technical difficulties here or there, so bear with us. Please be advised that the webinar is being recorded, and I do see it in the right hand corner now. So if everybody could you please mute your microphone so we don't get any background sound. If anyone has any questions, you can type into the chat box located at the bottom of your screen. And we have a person monitoring that, so they will get back to you as soon as possible, or we'll save it till the end of the webinar. If you wish to remain anonymous, hover over your picture, locate the dots, and you can delete your name or rename yourself or turn off your video. So, all right, well, with no further ado, I don't want you guys to hear me speak all night. So think we got Jack Wheeler, Steuben County Manager, first up.
Yeah, thanks, Brandon. Really appreciate it. And good to see everyone's face. I mean, I think we're all getting used to seeing each other's faces through Zoom. Not that it's good, but this is what we are dealing with. It strikes me that, this time last year, we had the really tough choice about holding our recognition day, our sort of press event for Recovery Day, whether to hold that virtually or to cancel. A lot of back and forths, and obviously we canceled just like most of the world. It's really, this past week marks, a somber moment for all of us, because each in our own different ways have had to deal with the pandemic and all the resulting impacts. See a lot of people that I know and respect, on this forum that have just done a tremendous job continuing to provide services to, folks who need them, especially in this difficult time. The pandemic has had so many different impacts upon us, both collectively and individually, that it's really hard to quantify. But the one thing that we know is that it has not lessened, it is more exacerbated the mental health and substance abuse issues that we're facing here in the county, in the state, in the nation, and across the world. The rates that we're seeing, our friends here who work in mental health, can attest that, the number of crises that we've seen, either from a substance abuse standpoint or a mental health standpoint, are increasing. So I think it's different this year. Every forum that we've had has been super productive, and I just thank everyone on here for those in-person forums where individuals could share their stories, and we could, learn more about services that are out there. And I hope we're back there, in the not too distant future. Maybe this time next year, we're actually holding the in-person forums. I sincerely hope. But having something like this is just so awesome, because it's another touch point for us all to remember the need that is out there. And, it's on all of us to help the members of our community. So I really appreciate you having me here. And it's always a pleasure to be working with all you fine folks.
Thank you. And before I introduce our next speaker, I'd like to say this. We're going to go to Sheriff Jim Allard next, but, Steuben County as a whole, our law enforcement officers have been some of the most supportive law enforcement officers towards the recovery community that I've worked with. And I just think it's a testament to them and the things that they do, because I know in the recovery community, substance abuse world, we learn to get a negative connotation on law enforcement. And these guys have really stepped up, and really, I know they've helped me out a lot, always been there to answer phone calls or call me right back. And they're always supportive of the recovery community. So I can't say enough about them. So without further ado, I'd like to give it over to Sheriff Jim Allard. You there?
I'm here. I had to unmute myself. Sorry. Thank you, Brandon. Those were very kind words. Since I've been sheriff, I've said repeatedly, and I continue to say, that I think addiction is our number one public safety issue. And the more that we can do to address that, the better off we all are. And, today, we had we lost another life, not directly due to addiction, but I think by the time that we're done with it, the allegation is that it will be tied to addiction. And we continue to see that. I think we had a dozen last year or thereabouts, and it's not getting better in that regards. I worry very much about what our children are seeing in this virtual school world, where they're home either half the time or all the time, especially those that are the children of addicted parents. And I wonder what the long-term effect of that is going to be on our society and on the generational addiction that we see in some of our poorer communities and poorer areas of our community. And I can't help but wonder that how much kids are seeing, how much more they're seeing now in their own homes and in the homes of extended family of people that are watching them, because they are at home so much more with virtual learning, and what the long-term effect of that is going to be moving forward on battling addiction. And I just got a draft of the House and the excuse me, the Assembly and the Senate bills for cannabis legalization today, that they're both coming very close to that. And the first draft that we got today shows 3 ounces or under as a legal possession. It's not illegal until it's a full pound or more of marijuana, and with a personal grow plan of 6 plants per person per household. That's going to be devastating, I think, for us that are fighting the fight. And as we move forward, it'll all become clear. But there's many challenges out there now, and you all know my feeling on our lack of ability to treat in the jail due to bail reform, how devastating that's been to the progress we were making. But we continue to fight. We continue to try and help people get to their recovery. We try to help people sustain that recovery. And I got to tell you, with the community impact panels that we do, and Julie can back me up on this, even though you think you've heard all the stories, there's always one new one to hear about either how someone is in recovery or moved towards recovery, or was unsuccessful in their first chance at recovery and has tried again. And I think that the biggest weapon we have is hope. And the fact that people will continue to try, even though it hurts, even though it costs them, even though there seems like no end in sight. If they can see that hope to recovery, and Brandon, I'll let you speak to that. I think that's our biggest tool and our biggest weapon in this battle. And having the available services, removing the stigma from the disease, and having the available services to help people find their recovery, because they're all unique. But we're here to help whatever we can do.
Okay. And that just goes back to what I said before you started sharing. Just to hear a sheriff say that, is more than I can say for a lot of counties. And I know it's been hard on the recovery community last year, this year. I know we had 141 overdoses last year, recorded overdoses, with 9 fatalities, as what Sheriff Allard was alluding to. And this year we have 27 with 2 fatalities already this year. So, I mean, it's a major problem. Connections a very big part of recovery, and the help is there. It's just about trying to find the resources and the people that are willing. And I know we have some things coming up, and us at the opioid committee are going to be putting these on. We want to make connections with people and do everything we can. So I'm going to move on to our first speaker tonight, Julie Haar. So I have a beautiful introduction here. I'll run down real quick. Julie is a KSAC senior substance abuse counselor at Steuben County Alcoholism and Substance Abuse Services for the past 17 plus years. She has been a counselor since 1987, has tremendous amount of knowledge and experience and skill. Julie was the Steuben County Court Liaison for many years, was instrumental in implementing the SCASIS jail program and the CIP Community Impact Panel that the Sheriff alluded to earlier, program with the DA and Sheriff's Department. She's been in recovery since 2 weeks after I was born. 8/9/1985. You know, that's amazing. I can't even say enough about that. So, and she loves working with people that are trying to establish and reestablish their value in life. And Julie says she is married to the best husband in the world and loves spending time with him. Their pups, cats, horses, chickens, and family at their beautiful water edge property. So without further ado, I'd like to turn it over to Julie.
You got to introduce her as Julie Haar, the rock star. If you can do it correct.
Well, I don't know who that person is, but she sounds fabulous. So thank you for that really gracious and wonderful introduction, Brandon. I appreciate it. And I think somebody helped on that a little bit, Kim Jessup. So I guess what I'd like to do, since we seem to have enough time, I hope, is just share a little bit about recovery and what I believe in about recovery. And then we'll talk a little bit about what the opiate piece is in that process. Opiates are only one drug. That most people don't generally start with the opiates. They usually start with pot, nicotine, and alcohol, and then evolve into the use of opiates eventually. So I got into recovery, as Brandon said, a couple weeks before he was born. I think he said, or right after he was born. Boy, that makes me feel old. And I got there, I was 27 years old, and I was desperately alcoholic and really did not believe that there was a way out. And so I made a kind of rash suicide gesture, and my family descended upon me and got me into treatment. And I stayed sober since that day that I went into treatment. And the way I've done that is to get involved with the support network, to be involved with people who mentor me through the process of living life. And I think that's really what most successful people do, is they find people who are capable and reliable and wise and willing to be the kind of friend that can tell you things that you may not want to hear all the time, and also help understand a little bit about what your value is as a human being. So I have learned in my recovery process, as well as in my professional career, to pretty much whittle down all the problems that we have in our community, whether they're substance use related or criminal forensic related or healthcare or whatever. I believe very strongly that this is a value problem. You know, we have a problem with people recognizing their own value, and they may grow up with generational struggles with understanding value or ever feeling valuable. And then there are people who have felt valuable and their addictions have deteriorated that value. So when they walk in the doors or make the phone call to a treatment program, what I hear them saying is, I'm scared, I'm tired, I don't feel like much of anything. Is there any way you can help me? And that's where we start. You know, how do I help you to help you? Has become sort of my mantra as a counselor. What do I do to offer you a better chance at feeling valuable? So the addiction, if I could just give a kind of thumbnail sketch. Hang on one second. That I believe, can you hear me all right? Okay. I believe that a lot of people don't understand that substance use disorders are a disease, biological disease, that's caused by a brain anomaly that results in people wanting more and being able to be tolerant of more of a drug than someone who doesn't have this genetic predisposition. So normal people can't go out and drink, a fifth of booze without going into a coma. People who are substance use people have a brain that allows them to develop tolerance. And in doing so, they begin to crave more and more of a drug, which leads to more and more dysfunction, and therefore the negative consequences that begin to affect themselves, their families, the community, their employment, etc. And here we are talking about opiates because opiates have always been an issue. Heroin addiction has been around since alcoholism, okay? It just didn't get a whole lot of attention until it started to hit middle-class rural America. And when that began to happen, people kind of stood up and said, oh my gosh, we have a problem. What are we going to do? And we're going to be doing the same thing that we've always done with people who have alcohol problems, cannabis problems, cocaine problems. We're going to provide the same kind of treatment, the same options, and help them to understand their biology and help them to understand what they need in the way of support and to revalue themselves. Am I making sense? I'm hoping that I'm not off track. As you can maybe sense, I still, after all these years, I have a tremendous passion to try and help people understand addiction better than they do, including myself. I'm always trying to learn a way to better treat people, to have a better skill set, to improve my knowledge. What's the new science around substance use disorders? To develop rapport with people, to be a reliable, dependable clinician who can meet people where they are instead of trying to further shame them or cause more devaluing. I think Jim said it earlier, which is a perfect 4-letter word called hope. I think hope is so important for folks who have very little hope. And by the time they get to dependence on heroin or any other opiate, the change in the central nervous system causes these people to have such tremendous pain, and they really struggle with being able to withdraw from the drug, and they become a real hostage to this cycle of using, withdrawing, and it becomes the center of the universe. And that powerful addiction causes them to say, do, and be things that they never thought they would ever be, say, or do. And in doing so, they create this merry-go-round effect of, people get so angry and upset and, banish them and shun them. And, they're not capable of being responsible. And it's not because they want to be that way. It's because they can't get out of the crisis. And then that usually leads us to what gets people sober is some kind of a crisis that stops the locomotive, dead in the tracks, where the crisis overwhelms the desire to use. And they usually end up in a hospital, jail, or treatment. And that's, as Jim was saying a few moments ago, we really had a great program going at the jail because we had a hostage audience where folks were in jail long enough to get withdrawn and to really pay attention to what had happened to them as a result of their use. And it was working great. We were able to get people into drug court. We were able to get them to treatment programs, halfway houses. And I've had many of my clients over the years tell me the best thing that ever happened to them was jail, if you can believe it. The best thing that ever happened to them was to be incarcerated, to give them the time they needed to get away from the drug physically and to think and not have a distraction. And in doing so, they developed a motivation and that hope that maybe this time they can make it work. So it really is tragic that these changes have happened that now allow folks to get out of jail immediately. And we all know where they're going to go. You know, they're going to get high. And I know it's about trying to treat people more judiciously, but in doing so, I think we're losing people. And that's really, to me, a much bigger problem than the whole bail issue. Again, an opinion of mine. And then lastly, I just wanted to talk about the COVID piece of this. I think what Jack mentioned and Jim has mentioned is the lack of connection, the lack of connectability, the inability to get to the places and be seen face to face. It's so difficult to replicate the intimacy of a face-to-face session on Zoom. You know, it's really hard. And we have folks who don't have the capacity or the capability of doing Zoom. So therefore we're left with like a phone call, you know, and talk about impersonal. We try to make it as personal as possible, but it's not the same as looking in someone's eyes and, you know, being able to say to them, I care, this, you can do this, and do some motivating. Trying to do it in this telehealth piece is really difficult. I think we're getting better at it. And my colleague Tim may agree with me, or Keith or Courtney, they're on as well. We are getting better. And in some cases, it is helpful to people to be on Zoom, but it's not the same as a live session. The other thing we're seeing, I think Jim also mentioned the children. We're seeing the struggle children are having, whether they're in a good environment or not so excellent environment. They're still feeling that isolation from their peers. They're not getting the social athletic opportunities that they, you know, help them to feel better about themselves. There's a higher incidence of isolation and suicidal thinking in adults and children. I was talking to my colleague, Pat Miriam, today, and she was mentioning the amplified sense of loneliness, which also leads to that value confusion, you know, how important am I kind of thing. So to me, those are all contributing factors that we're now trying to address in a method that is not as intimate. But I also have hope. You know, I'm hoping that with the new opportunities for vaccination and people being able to feel a little bit more secure about their health, that we may be able to improve our connectivity with folks again, and be able to get back to some sense of normalcy that will again generate that sense of community and connection. And I'm not in this alone. I have people who care about me, that gives that energy that people need to move forward with their recoveries. So few, I don't know if anybody has questions, if I've covered what you need me to cover. If there's anything else I could expand on, I'd be really willing to do that.
I think you did a great job. You know, I wanted to add something to that, though, that especially, I mean, the pandemic has been hard enough on people that don't have substance abuse disorder or mental health issues, you know, and I know from my own personal experience that I used majority of the time to get outside my head. So to be in a place to where you're stuck by yourself and in your thoughts constantly is literally what we tried to avoid in recovery for years, you know. So to be forced into that of no fault of your own is kind of a scary situation to be in. And I mean, you know I alluded to this in the radio interview I did, but that it amazes me how many people in Steuben County still think that it's not a Steuben County issue. Substance abuse, and substance abuse is very much within Steuben County, and it's very much an issue. And we have a lot of great resources and great community advocates and help, but it's very much a real issue there. And, you know, we really need to, as everybody's kind of alluded to, is that we need help fighting the stigma. We really need to make it, you know, the status quo to be accept, you know, invitations into treatment, to seek treatment, to be able to talk to our families about our issues and not feel scared. You know, that's one of the biggest things I think that's facing our communities as a whole, all over, is stigma and shame and guilt. Because as Julie just touched on, I mean, that's a very big issue. And sometimes it did take, you know, intervention, not their choosing. It did for me for a while, because for the longest time I couldn't get out of my own way. So, you know, jail did that for me. You know, so is Patty on? I thought I saw her drop off for a second.
I'm here.
Okay. All right. Well, we're going to move on to our next speaker, Patty Pregel. And Patty's a certified recovery peer advocate who provides recovery support services and outreach throughout Steuben County. She is part of the Center of Treatment and Innovation Mobile Recovery Unit, as you see on our screen. It's a wonderful program. I've had the pleasure to meet and work with Patty, so I'll turn it over to her. You there? Where'd she go? There she
Okay,
is.
can you hear me?
Yeah, gotcha.
Am I supposed to go?
Yeah, you're good. Yeah,
Okay.
please.
It completely shut my meeting off and I had to restart. I wasn't sure what was going on for a minute there. Sorry. Thanks, Brandon. And thanks, Julie. It's really great to hear everybody, you know, when I get on here and think, wow, look at all these people who are in the same group that I'm in. I'm a little nervous tonight. My anxiety's a little high. And I'm also a little emotional because I can honestly say that one of the reasons I have such a passion for like the jail program that Julie was speaking on, and the part of our organization that is working on getting into the jail system as well, to kind of collaborate with a team. I'm really big on being part of the team. But I went in sober 10 and I went into the jail 6 months sober. And it was the absolute worst 30 days of my life. And it was something that completely changed my life, It was finally a rock bottom that I knew I did not ever want to face again. And the people who were working there took care. They weren't just looking down their nose at me, and they weren't, you know, grouping me into a stigma, which I hate stigmas. And I think that's so huge. And this day, I still speak so highly of one of the CEOs. I happened to see him in family court. It obviously was all dressed. Such a chuckle, and I've seen him around, and you know, he's really been amazing. So that's kind of my little bit on how important I feel that is. So I would like to say that our Cody program is growing and seems to be really starting to take off now that COVID is a little bit lesser for our peer advocate for Catholic Charities Cody program. And I have been able to actually start meeting with my clients face to face. We are also ramping up our HCBS program, another aspect of my part. And, you know, we're starting to bring the clients who are being released from jail after their service and bring them into our
Cut out on everybody. Okay.
Yes.
Yes.
Shoot.
Yep. I was talking to myself and just talking away.
There you go. Oh,
So anyway, our Cody program,
here we're losing you, Patty. You're muted.
yeah, I don't know what's going on. I'm gonna have to reconnect my internet or something. I sorry guys, but thank you guys for having me. You know, our program really is doing well, and we're really to increase our connections with the community so people are aware of, you know, the extra support. And, you know, like Julie was saying about the support piece, you know, our program is great because you can, you know, add us to the list for your clients to be supported by somebody who is in recovery and, you know, can help them see that this kind of thing is possible. You can absolutely reach recovery. And if it's one person at a time, then it's one person at a time. It's the fact that we move forward with this that's so important. And I've had people say, you know, I don't know, I can't do Zoom, I can't do this. So one of the things we offer, which is kind of huge, is if you have clients who are unable to reach out to you or meet with you because of not having a smartphone or computer or internet or whatever the case may be, they can be referred to the Cody program, and we can in fact go out to them, meet with them, allow them to use our, you know, our equipment to connect with their appointments. And I've done a few appointments with clients, simply just go with them, sit with them, be there with them, just as an extra support. So it's really pretty amazing the things that we are able to do. Dale and I are kind of a small team right now, but you know, small teams get things done too. And that's, you know, that's where we're at. And I think as our program begins to grow, you know, staff would begin to grow, you know, so it's really amazing to start off with 2 clients and then end up with 30 clients. You know for a fact that you're in a program that's working hard to reach out to the community. So hopefully you guys can always reach out to me by email or phone. And if you don't have pamphlets and stuff that you would need for our program, like the explanations and what services are available, you can email Dale and myself and we can send you stuff. We can meet with you by Zoom if you'd like more information also. So, I was really excited when I was asked to be part of this committee and to join you guys, because I get to learn from an entire team of people more things than what I know now. And I hope that, what I am doing is going to make a difference. And the fact that the law enforcement of Steuben County has been so open to our program, has been so willing to give us that opportunity to speak and to present to them, to really give them things to say, hey, we know that you're the good guys. And, it's really important to me. Like, I really feel like Brandon had talked about that, if you get that negative thought in your head about the legal system and so on, then when you have an encounter, there's a chance you're going to have an attitude, you're going to be, whatever that case may be. And, I really am so passionate changing that. When I get a chance to call my clients who are incarcerated, it is such a big deal for me to say, I was there, and they really have a lot of resources available to you. So this doesn't have to become a revolving door. Let's get you out. Let's get you connected with the community. Let's give you every possible chance that you can have
Oh, you cut out again, Patty.
to make this transition. It's pretty amazing. I couldn't ask for a better job. I honestly, truly could not ask for a better job. And it amazes me every day that I get to do everything in my power to reach so I also have my mental health certificate, so I can work with people, who are struggling with mental health, and right now that's a really big deal. So it's really amazing that we can link people to so many services. The things that we can't do, we're learning all the resources in the community to kind of give everybody that fighting chance. So thanks for having me, guys. I'm really grateful to be.
Very good. Very good. Well, real quick, for those that aren't familiar with Steuben Prevention Coalition and the Opioid Committee, it's a group of individuals that get together from all walks, all professional backgrounds that really, as the term says, it takes a village, and we really are a village. We have, everything from myself being a certified recovery peer advocate to retired teachers to assistant district attorneys, law enforcement, substance abuse, mental health. I mean, we have the gamut, teachers, everything. So, it's really a great program. If anybody's interested in joining, we're always accepting new people. We'd always love to have people as part of the Steuben Prevention Coalition or as part of the Opioid Committee. You can find us on Facebook. You can put your contact info in the chat here and somebody will reach out to you. I put my contact info in the chat box if anybody wants to reach out to me. And I'd like to say, we'd love to have everybody take a couple minutes to take our community perception survey that I believe the link's on the screen or in the chat box. And if you're interested in receiving information about our upcoming webinars, if you want to put your email address in the chat box or contact info, or like I said, find us on Facebook under Steuben Prevention Coalition. And, I think we're going to do a little question and answer if anybody's got any questions or want to throw anything out there. Did we have anything in the chat box?
There's quite a few in the chat.
Okay.
Yeah. We do. So the first one was, has there been an increase in overdose deaths since the pandemic began?
Yeah, I would say yes. There's definitely been an increase in overdoses as a whole, I would say. Deaths, yeah,
Compared to the year before, I think definitely.
Yes, I agree.
Yeah, we were tracking in a terrible direction in 15, 16, 17. It thankfully decreased a little bit in recent years and then spiked again this past year. And certainly to Brandon's point, the number of overdoses that are reported, the state system is not fantastic, or the state reporting. We know that it's very underreported, actually. But we have seen the numbers increase, not in the direction that any of us want or need.
yeah, for sure.
Thank you. We had another question. Does insurance pay for treatment?
So if you'd like, I can take that one. Yeah. Most people who have insurance will have a benefit that covers substance use services. Of course, there are multiple levels of care that people can be referred to. Residential care may or may not be covered by insurance. But we take care of all that when people come in the door. We work on it with them, and we seek whatever options we can to help people get into treatment.
That's great. Thank you. We had another great question. How else can we support people within their recovery aside from listening and encouraging them?
Anybody?
Is that as well?
Sure.
I think one of the most important things that people struggle with is recognizing that consequences are what help people get better. So if someone is involved in an active addiction, then helping them to recognize that their behavior is not okay, and that they're it's not just about being supportive in the way that loving, etc. I guess I'm having a hard time finding my words for this, but that concept of tough love is really hard. And I think it needs to be, each person needs to make up his or her own mind about working with someone they love who has a substance use disorder. But without consequences, the addiction continues to run a person's life. So the person who's actively using has to feel the pain of their use strongly enough that they want to get help. So I hope that helps.
And I would also add to that it would be good to, when you're talking to your loved one or somebody that's dealing with substance abuse, it's always great to listen, but it's also good to kind of shape it in a way to say, maybe I'm not the best person for you to talk to. We have clinicians or peer advocates, some having them sit down with somebody that's been through it and living a life of recovery to really open up and get a lot of stuff out, because I'm big on saying that drug use is only a symptom of the problem.
Right.
It's a much bigger issue, it's a much deeper issue. And I know in my personal experience, I was always running from something, as I said. So it was much more a deeper issue, a deeper rooted issue, that until I really had somebody that totally understood and could sit down and communicate with me, it was a losing battle. Because families, if you've never lived it or you don't quite understand it, you can talk forever, but you're always going to have that question, and it's always going to make I know it always made me with my family feel a little disconnected. So it's always good to kind of push towards treatment, towards resources that are in the area, and
Self-help meetings.
yeah, self-help 12-step program, higher power, all sorts of different avenues. But that's why we have people in the recovery community and substance abuse treatment to really engage with those individuals. So do we have any other questions in the chat box?
There are a few. I just wanted to tack on to that there are community support and awareness programs that are available. Teresa's on tonight, that she's involved in one, and we can put out contact information for that. A lot of our treatment facilities also provide services for family members of those struggling with addiction. And there are Narcan trainings that are available. There's a lot of different ways to really educate yourself as a community member and to also get some support, because it can be really challenging to deal with a loved one, you know, who's struggling with addiction. So there are services available to you as well. Another question that we have is, how do you feel the community could help to fight stigma surrounding addiction?
Anybody want to take it?
I'll take it. I think education, exactly what we're doing tonight. The more we talk about this as a disease like any other disease, the only difference with this disease is that the symptoms are behavioral instead of physical. And when we see that behavioral problem, we want to react to it as though the person is doing this by choice. And the more that people understand the biological nature of addiction, that it has it's just a brain disorder that has to be addressed, the more people will understand and judge less. So I think everything we're doing tonight is key. You know, read, get information, go to an open self-help meeting, you know, talk to people in the know, so to speak, and stop whispering.
Yeah.
You know, I remember when we whispered about cancer and HIV, and we need to stop whispering about addiction. You know, it's so important.
Yeah, there's definitely I think it starts with each individual person too.
Right.
You start changing it within yourself and help carry the message along. That's going to go a long ways, because you look at, you know, I don't care who you are. I've had the unconscious bias of when I think of an addict, you know, a lot of people just switch to the homeless gentleman down the street, you know, not necessarily the doctor next door, or, you know, law enforcement or correction officers. Like, you know, addiction touches every walk of life. There is not a single area of our life, our country, that has not been touched or affected. So we need to get out of that mindset that it's just, you know, the classic homeless person or somebody out robbing and stealing, because sometimes it's people you don't even think of that are just hopelessly addicted, just hiding it well, you know.
And I think we have to, I'm sorry, Brandon.
No, you're good.
I think we have to change language too, the verb, what we say about people. You know, there's a push to change language, like, oh, he has a dirty urine, and instead say he has a positive urine screen. Or, you know, even the word addict is becoming sort of a passé statement, you know, person who uses substances. Just changing how we portray a person who has this disease. You know, that just the language alone is another change we can move to.
Yeah, I think it's a process that we're working on as a whole, all of us involved.
Mm-hmm.
You know.
Yeah.
Did we have any?
We do. We have a few more. So this is a really great one. How can community members find out about future forums?
Well, our next webinar is going to be held in May. We're planning on offering a virtual Narcan training. You can, however we're going to get the word out, that I believe the same way we did this time, through radio stations, news, internet advertisements. You know, our Facebook page at Steuben Prevention Coalition. I know AIM has listed it on our website, local news. There's you know, I honestly, I would say just log into the Steuben Prevention Coalition Facebook page and it will be there. That would probably be the best source, right from the horse's mouth, if you will, right?
Thank you. What more do you think the county could be doing to provide mental health services for people coping with addiction?
I see Julie unmuting. One of the things, and I wish I could hear the sheriff's laugh. I hear it in my head because his laugh is infectious. But one of the things, and I see Hilda Lando is on here. You know, I'm particularly grateful to the Steuben County Legislature. Hilda has been at the forefront. Carol Ferratella and others have really driven a lot of this effort. And you know, one of the things that gives me hope and a lot of confidence is how much they've invested. The sheriff and Julie talked about the program at the jail, and you know, when staff or you know elected officials like the sheriff have recommendations for expansion of services, they take that very seriously. We're you know in a time when counties across the board because of the pandemic are slashing resources. We had, you know, a very strong directive from our leaders, from our legislature, not to touch those funds and to do whatever we can to expand those. So, Julie, I'll leave it to you, but I think a shout out to you know the decision makers who really invest in the resources is needed.
Yeah, I agree with you, Jack. I think, you know, you've done a marvelous job. I think the legislatures really opened their minds and their hearts. I've watched the legislators come to the meetings. Hilda's here tonight. You know, I think it's like anything else. This is snow that is starting to permeate more and more of the community. And when that happens, I think people will be more willing to see their tax dollars go towards things, a number one health problem in our whole country. You know, but because of the stigma, it doesn't get the respect and appreciation and services that it requires. And I haven't made a formal announcement of my absolute love for Sheriff Allard, because he has done so much for all of the forensic and the law enforcement side of things that has, in my opinion, only enhanced our community tremendously. I love the coordination of effort in our county right now. That has not been as tight as it is right now with Jack as the manager and Jim at the helm with the jail. And I just love seeing all of our folks come together in so many ways and so many layers. I think we're doing a really good job. Can it be better? Of course. But I think the legislators are hearing more and being more aware of, you know, where the services need to be enhanced.
Yeah, Hilda's the co-chair of the opioid committee, so she's very involved. She's part of. Yeah. I mean, she's part of the, you know, so we have that representation right there. And honestly, that's a question that if it was a perfect world, we'd have a lot of things. But I think a lot of grassroots initiatives such as like this, just people, community members, regular everyday people coming together to support, you know, just getting out there and just spreading the word, really being supportive.
If I could jump in real quick, Brandon, some things that we're working on right now, moving forward. We've sent 2 deputies to crisis intervention training, which is a 40-hour training so that they can team up with mental health professionals and respond to scenes as a team. And the mobile crisis unit for the county has been able to participate in that. So we've actually had some success with that, where they actually go to scenes of people that are in crisis but not yet violent, and with the goal of getting them into treatment before they have to go to some sort of in custody treatment. And that's been working. So we're moving forward with that. And the other end that we're looking at is a veterans court, similar to drug court, but only for veterans. And again, COVID's got us on the back burner, but you should see that coming within the next year.
Another question, maybe directed towards law enforcement, and this is a two-part question. How has bail reform impacted the community, especially from the treatment perspective, and how is that being addressed?
So the impact has been, it's on many layers. It's not only on the fact that any drug charge other than the A1 felony of trafficking more than $75,000 worth of drugs is a mandatory release. So even if you get arrested for a B felony, you get taken to jail, they have to release you at arraignment, which is going to be within 12 hours, unless there's other underlying stuff. So that person, where I see it the most detrimental, is the low-level dealer who is only dealing to sustain their habit. As Patty talked about and Brandon talked about, they no longer have that opportunity to get clean and get into treatment with us. They're given an appearance ticket and released the same day, right back into addiction. And I think that is the most detrimental part of the bail reform for this group of people. The other side of it is by restructuring the way in which we view drug offenses, we have made them appear to be of the same seriousness as a speeding ticket. And I think that message to our youth is going to be incredibly damaging as we move forward. And I think that the overall perception of narcotic use and narcotic sales as just part of our society and it's not that big a deal sends the entirely wrong message to folks. And we hear it from those that we arrest. 3 nights ago, we arrested the same person 3 times for felony drug charges, and they were released every time. It was over a weekend. It is what it is. What we can do about it is continue to do whatever we can to get people into treatment. And other than that, there's not going to be any change unless the legislature changes the laws, which they're moving farther in the opposite direction than in any kind of a direction of consequence and responsibility. So I think all we can do is to continue with things like the crisis intervention training and moving to where we can help those that are ready for help. Unfortunately, as anybody who's ever been in addiction in that world, you're not ready for help when you're still getting high. So that's my perspective on that.
Excellent.
Brandon, can I add a piece into this?
Yeah.
There was, it's a very small, minuscule positive that I can share right here. And that is in my community, they've just begun the new divergent program, which, it's great because it gives that new perspective, that new attitude, that new position on law enforcement moving forward in a positive direction. And I know it's very brand new, and I know it's only just started, and I'm excited about it because I think that's a great place to link our services. If somebody is willing to come to this class and go to treatment, that's a really good time for them to be kind of introduced to, what I'm doing and what Dale's doing and different things. And I spoke with somebody recently in my community, and they actually stated exactly what I was hoping would happen. And they said, I just got arrested. I got a drug charge, but here's the thing. You're never going to believe it. I didn't get arrested. They told me I had to come to this class and that if I signed up for treatment, that was the next step. And I was ecstatic. I was so happy and so excited. And I was like, that's one person who's maybe going to spread the word and the mindset of, they're looking at us with these eyes and this attitude now of, I see that you're sick. I see that there's an issue. We want to help you fix that and get you into, a direction to change your life. So yes, it was only one person, but I thought it was absolutely huge. And I think, I think we deserve to hear those moments of positivity. And, it does feel like we take small steps sometimes, but all those little baby steps will make it the long haul. So I was really happy to hear that, somebody's attitude was more positive and that they were moving towards treatment that I hope will stick. And I hope that I'm part of that and whatnot. But so I just thought you guys deserve to hear that.
Thank you. We appreciate it. And unfortunately, we've come on the hour. I think, Katie, did you have something to say real quick? There you go.
Did I?
I don't know.
The recording,
Oh.
the recording for tonight's
Yeah, that's it.
forum will be posted on the Steuben Prevention Coalition YouTube channel next week, probably Tuesday.
And I put that in the chat
So if
box
anybody
for
wants to
everyone.
see it.
Excellent. All right. And now remember, guys, if anybody's interested in joining Steuben Prevention Coalition or the Opioid Committee, you can always reach us on Facebook. I know multiple people put their numbers, contact info in the chat box. We'd love to have you. Our next webinar will be in May, and we are planning on offering the virtual Narcan training. So that'll be an excellent one to come to. We meet for the Opioid Committee and Steuben Prevention once a month. So if you'd like to come aboard, we have more conversations like this, so thank you. Thank you, everybody, for joining us tonight. And especially
good job, guys.
thanks for the speakers, especially too.
Thank you.
Okay. Take care, guys.